I'm Jenny Basran. I'm an internist geriatrician, associate professor, and head of geriatric medicine at the University of Saskatchewan in Canada. Technology in itself isn't innovation. Innovation is trying to do something better for better outcomes, and technology is really an enabler in that process. So where I think we can make the best gains in aged care is by changing the process of care that we provide. Currently, it's very traditional, one episode, one condition, one treatment, and off you go. And unfortunately, most of our complex patients, whether they be older adults or complex with mental health, addictions, HIV, those types of conditions, they require a different approach. They require very similar to a geriatric approach where it's comprehensive, issue-based, continuous care, following the patient throughout the continuum of care. And I think if we change our models of care to reflect that and then apply technology to allow us to deal with that complexity and to really take it further with things like telehealth and telemonitoring, that's really when we're going to make the big gains in our healthcare system with both great quality as well as efficiencies. You know, there's this stereotype that the GPs are resistant to change. And in fact, when you speak to them, the most challenging patients that they deal with are often the geriatric patients or the aged patients. And they really just want tools. They want tools and approaches to make it easier for them to do the right thing. And I think if we can apply the models and make the models such that it allows them to make those clinical decisions without trying to pull in all this different information, it actually will engage them. And many of them are very happy to be working in that type of model of care. They understand it. They realize how much easier it is for them to manage their patients. So I think it's really around, approaching it as how do we make it easier for you to do the work that you want to do. In Saskatchewan, as part of our patient flow, ED Waits and Patient Flow initiative, we are looking at the clinical record. And independent from our process, we had the team in acute care, so patients, caregivers, the frontline staff, all look at the processes of care. And separately, we both came to the decision that it should have a single assessment tool. So everybody does their assessments into one assessment tool. It's all put together and displayed in an issue-based care plan, so that you have the issue, and then next to the issue is the medications that go with it, the tests that were done with it, what the different interdisciplinary team members are recommending and suggesting, and what are the red flags and goals for the patient. So putting that all in there, and then you have each of your issues based like that. If you develop a record like that, and it has to be developed both by the patients, how do they want to see it, how do you want to display it, the caregivers that are providing the care, both the informal caregivers, the families, as well as the formal caregivers, the frontline staff, the nurses, the therapists, the physicians. Then when you look at all of that together, that's when you're going to have a record that's meaningful. Right now, an electronic record is just a digitized version of a paper record, and the paper record is inefficient. So making a paper record into a digital record does not really improve care. It's when you look at, again, that process of how do we want to interpret all this information? How do we want to collect this information? We have it everywhere. Putting it everywhere digitally is not really that helpful. So you have to take all of that information and put it together into one useful record. And technology is really the way to do it. Technology allows us to do it without rewriting things, and we can pull it from multiple different sites. And that's really when you're going to have an efficient clinical record.